I do want to start with some of the conflicting messages because just earlier today, the HHS says, and I'm quoting them directly, that the Cyclospora outbreak is contained and salad is safe to eat. I look at some of the CDC numbers. We just cited the ones through August 5th, but there are new numbers through August 11th showing a 33% jump in cases. When you go through certain states, the state health departments, they're also reporting what still continues to see some sort of persistent increase in cases. What am I supposed to believe right now about where we stand in this?
Yes, absolutely. Great, understandable question. And what I would say is the CDC data reports confirmed cases. And so right now they're reporting nearly 14,000 cases. And their website also reports there's about 10,000 still under investigation, meaning that number might go up. Right now, it's not required to report these cases to the CDC. It used to be under FoodNet, but now it's not. So states may have higher numbers. States may also be using data that aren't confirmed but are suspected, that they're not confirmed by labs. So the numbers absolutely are likely higher. And those are just the ones that are suspected. If somebody gets better or doesn't have symptoms that require testing, those numbers aren't counted as well. As for whether this is contained, I would say there's a better handle on it now that they're tracking it, states are communicating. But unfortunately, when you don't fund surveillance systems and there's been staff cuts, I don't think FDA and CDC have the capacity they had in the past to handle something like this.
I do want to go there. Before we get there, just explain to me, when I see in the CDC data, it talks about the unresolved pool, which actually fell in the most recent. What does that actually mean?
So sometimes it can be that they're waiting on laboratory confirmation, and when labs are confirmed that it is Cyclospora, then we'll see that number move to the confirmed, and some of the unconfirmed will then go down. And sometimes they might think a case is Cyclospora, and then maybe it comes back as like E. coli or Salmonella, and so that will change then as well.
What is the number for the public that is concerned? And let's face it, there are a lot of people that are scared now. When we talked to the CEOs today, I mean, they were even saying anecdotally, there are people that, they're just staying away from anything raw lettuce, raw produce whatsoever, whether it's linked to them or not. Should we be looking at the illness onset dates? Should we be looking at hospitalizations, or just keep an eye on the reported cases?
I think it's a combination of everything. And even to have over 700 hospitalizations is really concerning. And there were 2 deaths as well. And both those individuals, my understanding is they had other medical conditions. We do see Cyclospora every year, as well as other food-borne diseases, but this is 10-fold times greater than other times. They've identified at least one source, the Taylor Farms, and those products are now off the shelf. So hopefully we'll start to see a slowing, but that doesn't mean that's the only source. And that's why it's important to, make sure you cook vegetables, peel fruit. And even though washing won't get all of the parasite out, it certainly helps. So, just really having that food safety mindset right now is important. Absolutely still should be eating fruits and vegetables.
Well, not to be glib, I mean, you say it's pulled off the shelves, but there's a lot of anecdotal evidence of people finding products made by that company still on the shelves. And this gets to this idea of trust. I mean, I understand there's a science behind it and what's real and what's not, but there is perception. I mean, and I'll just pose this question.
And we don't know it's the only source.
Exactly. So I guess my question to you, and I'll just be blunt, would you go into a grocery store today and pick up a bag of lettuce?
I have actually changed my practice, and what I've been doing is getting romaine lettuce and peeling the top layer off and washing it well. I had been a big bag lettuce person, and just lately I haven't been, just given the number of cases. But, I continue to eat other vegetables, cook them, and then fruits, still eating those as well.
With regards to the contamination that we do know with regards to the lettuce, how much confidence can you have that contamination didn't also cross over into other produce like herbs or other types of leafy vegetables?
So I don't think we can be confident of that, but they're still doing the disease detective work where, they have the case investigations and try to track it back. And at least for the initial couple thousand cases, I think about 6,000 were tied to that Taylor Farms farm in Mexico. Those were linked to the iceberg lettuce, the shredded lettuce. there's still so many cases in my mind that aren't accounted for where that outbreak comes from. And that's why I think just continuing to be mindful of how you're washing your vegetables, and if you have symptoms, monitoring for them and think, I could be exposed, and go talk to your doctor. But in general, it's safe to have the fruits and vegetables.
I want you to take us inside the CDC for a second. For those who maybe look at your name and say she looks familiar, you left your very prestigious job at the CDC just about a year ago in protest of HHS Secretary RFK Jr.'s ousting of the director. You've claimed that RFK censored CDC science, politicized the processes, and expected scientific leaders to function as, quote, rubber stamps. I was looking at a number, and it says a former CDC lab director says the Cyclospora team shrank from 11 people to 3. Does that sound about right to you?
That's accurate. And I would also say 25 to 30% of the overall CDC workforce is gone. And so you've got less boots on the ground being able to do these inspections and investigations.
Did the loss of those people, in your view, limit the ability to test, slow testing, or in some way weaken the potential response to an outbreak like this?
Absolutely. And also with some of the funding changes at CDC, there was a food program called FoodNet, which would look at different pathogens like E. coli and Salmonella, and Cyclospora had been required for reporting until last year due to funding changes. So that's another just showing that the capacity isn't there like it used to be.
Is that situation as it stands right now, and setting politics aside for a second, is that something that's rectifiable, whether it's through this administration or a subsequent one? Can we get the CDC back to a level where, in your view as a scientist, you think it would be staffed enough and independent enough to actually police and react to these outbreaks?
Absolutely. And I'm an ER doc, so I always say I don't care if you're a Democrat or a Republican when you come in and see me as a patient. And I feel that's how public health should be as well. Taking care of communities, following data and science. And so if they have the appropriate resources and are able to bring experts and staff back, they will absolutely be able to protect the health in our country. But unfortunately, today, they don't have that capacity to where they did before.
We spoke with someone who said they would probably trust some of the state health agencies more than they would the CDC and the federal health agencies. You were there. You talked about this idea of rubber stamps. When you were there, did you see anything where career scientists recommended, changed, or suppressed any evidence that could have maybe protected the public, not just with regards to Cyclospora, but for anything?
Not that I saw, because we moved forward. I was asked, I've reported on a measles toolkit to put forward recommendations that included things that weren't evidence-based, like steroids or antibiotics, and we said no. I was concerned because of the requests around things like that weren't evidence-based. And when the vaccine committee members were fired and they moved forward with a new vaccine committee group that did put forward recommendations that weren't evidence-based, that's when I knew I had to resign.
Trump just issued a vaccine framework. He reclassifies childhood vaccines, several of them, I should say, calls for separate MMR shots once available, recommends administering vaccines at separate visits. Is there a legitimate scientific case for this or any part of it?
Unfortunately, there's not a scientific base for it, and there's actually not an implementation ability to do it. There aren't, in the United States, the ability to separate out MMR into 3 different shots. And if you do, you're actually going to do exactly the opposite of what they're saying they want to do. It'll increase the number of injections for children. And if they're worried about things like febrile seizures, instead of having a single shot, now they'll have 3 shots. So there's no science or evidence behind it, which is concerning. I think when you have a secretary and a president with no medical experience, and the acting CDC director who has never been a practicing physician pushing down science and data, that's where we have issues. We should be looking to our pediatricians and our scientists and the vaccine specialists to really be driving the data, science, and policy recommendations around vaccines.
I know you resigned in protest, but you were there for several months. Was there any guidance that you allowed to go out that you believe was unsupported by scientific evidence?
No, I held my ground, and I testified before Congress about that, because to me, that was my red line. If I signed off on something that wasn't scientifically accurate, I couldn't do that. And that was one of the reasons why, even on things like thimerosal and additive and vaccines, we put up an evidence-based summary that showed it wasn't linked to autism. The secretary took it down, but I stood behind the development of it.
Erica Schwartz was confirmed as CDC director, I think, last week. Is there any action you think that she can take over the next few weeks or so that would actually restore confidence, or at least prove that the CDC is genuinely independent and operating on the basis of scientific evidence?
So she's been put in a very difficult position with the executive order that just came out this week. You know, if she wants to show independence, I think she can just say CDC will not be following this executive order because it's not based on data or science, and that she stands behind the original vaccine schedule that now everybody's following from the American Academy of Pediatrics because there's a lawsuit against the CDC childhood vaccine schedule currently. I think she could also look at what's happening with things like Ebola. The movement restrictions and things like that don't align with the World Health Organization recommendations. And with hantavirus, the secretary overruled CDC scientists. I think she needs to say that that won't happen. She'll protect the health of Americans in our country and around the world.
All right.